It's a fairly common one for us to look at, but it is also a common cause of hair loss. So if you are hypothyroid, having hair loss is a common side effect of that. And so we want to check a full thyroid panel if we're dealing with hair loss. So TSH, T4, T3, as well as your thyroid antibodies. Your thyroid antibodies are something that isn't normally checked in like a routine thyroid look, but it should be, and it should be looked at for fertility, especially because if those antibodies are high, even if your TSH is normal, there's a sign there that your immune system is doing something. And if your immune system is not balanced, is not happy, for lack of a better word, there's potential impact there when it comes to implantation and just embryonic development. So we want to look at a full thyroid panel if we're experiencing hair loss. We want to look at a thyroid panel if we're experiencing fertility as well. So stress, viruses, medications, nutrition, which we could kind of link in with deficiencies, but let's actually circle back to that really quickly. From a nutrition aspect, if you are someone who is not getting enough calories and not getting enough protein specifically, that could be the root cause piece. Your hair is protein, is made from protein. So if you are significantly protein deficient, then of course you're likely not able to grow hair. It's normal for us to lose hair, but if you're not actually growing hair back, then that thinning is just going to be a very slow process that happens. So really considering how you're eating and fueling your body for a wide variety of reasons, but especially this one, you're going to look at androgens or testosterone, potentially ruling out PCOS, looking at insulin resistance, looking at different deficiencies, iron and B12 specifically, and your thyroid. So I listed a few different things in there in terms of lab work, your CBC, your iron, your ferritin, your B12. I'd even throw your vitamin D in there, honestly, as a potential deficiency. If that's low, and just so many other factors going on, I would want to look at that as well. We want to look at your thyroid. We want to talk about your cortisol. We want to look at your androgens, your testosterone, and your DHEAS. And then we also want to look at insulin resistance, because remember when we talked about elevated testosterone, one of the root cause pieces of elevated testosterone could be insulin resistance. So checking fasted insulin and fasted glucose. These are all standard labs that I include in a preliminary workup plus others. But it's interesting when we talk about hair loss in a vacuum and not looking at the fertility aspect, but a lot of the labs actually overlap. And this is what makes hair loss being an interesting symptom as a potential driver for us to understand the root cause as to why maybe you aren't getting pregnant.